Brad Severin, and I'm from Sherwood Park, Alberta, Canada. I had a full right hip arthroplasty, which means a complete replacement of the right hip. In Canada, it's a terrific system if you're able to wait and wait out the time in the queue. It's free, of course, but sometimes the wait is just far too long, far too painful to cope with in my particular circumstance. Well, when they said we're taking you out of the queue because of the blood sugar management issue, you're going to be tested again in 3 months. And then at that point, if we're happy with it, then we'll put you back in the queue. I just thought to myself, this is nonsensical. My blood sugars are under control. The number is a rolling average, so what they're doing is picking up numbers from 8 months ago and averaging them in, which seems ludicrous. Dr. Kasman expressed, that certainly it's a reasonable requirement to have your blood sugars under control, but I demonstrated to him during our consultation period that clearly that was the case, and that it's very easy for him to accept then that we could go ahead with the surgery. And it was at that moment in time when my surgeon assigned to me in Canada said, yeah, you're out of the queue until we get this dealt with. And then, oh, by the way, when we test you 3 months down the road, if we're happy with that, you'll be back in the queue, which then means a year out, you'll be eligible for a surgical date. And I just thought to myself, this is ridiculous. I cannot continue to live with the level of pain that I have for another 15 months. So I then started researching what the options were for private surgical attention in the U.S. And that's when I came across the Timely Medical website, and then started looking into the website in depth at the stories, and really those were the things that were very compelling to me. I wanted to know what other people had experienced in using this service, and whether it met their expectations from the perspective of the outcomes, and whether or not they felt that the value was there. And everything that I had read and everything that I had seen from the website told me that using Timely Medical was absolutely the right answer. When I saw the series of videos that one of Dr. Kasman's patients had made, I believe his name was Glenn, those videos were extremely compelling to me. And the things that he said in those interviews, in particular the time frames of when he was on a walker, then moving to a cane, and then being without any type of assistance, I told myself that's me. That I want to be that guy, and that's really what helped me make my decision. I thought if Glenn is typical of the results, then there's no reason why I can't experience the same thing. So I sent off an email to Rick Baker, who is the consultant coordinator with Timely Medical, and I received a call later that day from Rick Baker, and we had a lengthy conversation. I had expressed to him the story that I've told you about being in the queue, and so he took all that information, then had a conversation with Dr. Kasman, and he then arranged for Dr. Kasman and I to have a conversation, and the next thing I knew, I was talking to Dr. Kasman and we were setting a date. So we arrived on a Tuesday and around noon, and I had a consultation booked with Dr. Kasman. And that was the first time that I would actually meet Dr. Kasman. Had a great meeting with him. We had so much in common, outside of the professional practice. I think to myself that if I lived here or he lived there, we'd be friends. He's just such a great guy. Then we had a down day where we just kind of organized ourselves, and then Thursday morning we drove to the hospital, and I go into surgery at 10 o'clock, and I wake up in recovery at 12:30. I'm back in my room by 1:30, and by 2:30 I'm up on a walker. Scott Radomski has come in and introduced himself almost the minute I'm in the recovery room. 2:30 in the afternoon, we're walking. I'm cruising the hallways with the walker and talking football with Scott. I think I walked 3 or 4 times that day, just in the hallways on my walker. The next day, Scott came and early in the morning, and we were on the walker again. Went for a few walks, and by 2 o'clock in the afternoon, Dr. Kasman came by and we had a conversation. He looked at Scott's report and said, "I think it's time for you to go home." So in the hospital overnight, went home the next day, and sleeping in our own quarters the very next day. Scott came again Monday morning, and he goes, "Yeah, I'm collecting up all this stuff and taking it back." He says the hospital always knows I've been out to see my Canadian patients when I come back with an armload of walkers and raised toilets and stuff. So Monday I was after the exercise session with Scott and finished the icing, I was walking without a cane. So that's Thursday, Friday, Saturday, Sunday, 4 days post-operative, I was walking without any kind of assistance. The best way I can explain it to all my Canadian friends, it's like taking a slap shot in the butt. There's going to be some pain associated with that and some residual pain, but it's definitely not the kind of pain that you're experiencing prior to the surgery. Prior to the surgery, my wife probably explains it best. I couldn't make a slight shift in weight or motion without groaning or expressing the pain verbally somehow. Now there is absolutely nothing. I just feel blessed to be able to have the resources and ability to come here to work with Dr. Kasman on this procedure, and to have him put me in a position of rapid recovery and restoring me to what is my normal routine and my quality of life.